Hi, I'm Tamara Rickard. I'm a physiotherapist at Solitude Health in Maxville. My apologies, I'm not there with you today, girls. I didn't quite make it home in time from my holiday, so I'm just talking to you today from Newcastle. So I'm a bit limited. I don't have the models that I'd normally use and some of the things I'd use for demonstration, but I'll just do my best and I'll be sure to give you all the information that I can. So physiotherapist, I've been a physio for 12 years. I've been teaching and doing Pilates for probably a little bit longer than that. And I'm also a mother of two. So my job today is just to give you a bit of information about pre and post pregnancy exercises, the muscles in the body and their effect during and post pregnancy, safe exercises that you can do pre and post pregnancy. And I'll just touch briefly on some of the injuries and conditions that present to physiotherapy during pregnancy as well. And I'll just do a little demo of just a few of the exercises to throw in there that you might find beneficial as well. So the first thing I wanted to talk about is prenatal exercises, so exercises that you're doing during pregnancy. There's huge benefits to continuing exercise during pregnancy. The main ones being maintaining a healthy weight gain during pregnancy. It helps to minimise swelling, great benefits for your mental health. It can help you recover faster as well post-birth, and just helps you cope with the demands of labour. So, you know, sometimes your labour, some people might be lucky and have a short labour, but some labours may go for 24 plus hours. And if you've maintained some fitness and strength during your pregnancy, you'll be able to cope with that a little bit better. So the types of exercises to do during pregnancy, walking's obviously one of the main ones that we use. Pilates and yoga are good ones to do. Just with your Pilates and yoga during pregnancy, try to make sure that they are specific for pregnancy or that your teacher is trained in pregnancy Pilates and yoga. All water-based exercises are great, so swimming, aquarobics, all those sorts of things are beneficial. Dancing is a good one as well. The main exercises to avoid are just your anything with high risk, so risk of falling, so dangerous horse riding, skiing, water skiing, snow skiing, those sorts of things where you might actually injure, higher risk of injury, avoid those. A couple of my favourite stretches to do during pregnancy. So what I find for a lot of women during pregnancy and post-pregnancy with breastfeeding is they present with a lot of thoracic pain, so pain through here. So a really nice stretch that I like to do that's great during pregnancy, but you can also do post when you're breastfeeding, is your arm opening stretch. So a lot of you probably do this if you're already doing Pilates. And this one's where you're lying on your side. You may or may not have a pillow or towel under your head. Both arms start out in front, reaching that top arm away from you, opening the arm up. Not quite enough room here, but let that arm stretch all the way back. And it's a really nice shoulder opening exercise. It gives you that rotation through the thoracic spine. And you can lie there for, you might just stay there for 10 seconds or you can lie there for 30 seconds. And you can circle that arm back around and repeat doing that on both sides. So that's a great one to do for the thoracic spine. One of the other ones I like is the glute stretch as well. When I touch on the pain conditions and issues that like physiotherapy presentations, I'll tell you what this one's beneficial for. But your basic glute stretch during pregnancy is you're not supposed to be lying on your back. We just alter this one to sitting. So you're popping one foot onto the opposite knee, bringing the leg in as far as you can, and then you're just coming forwards until you get that stretch in the glute there. Okay, so that's also a nice one to do and a safe one to do during pregnancy. Okay. So the conditions that we will see present to physiotherapy when pregnant women are coming in, the main thing we see is what we call pelvic girdle pain. So pelvic girdle pain is any pain conditions within the pelvic girdle. Okay, so it's a general term. So this consists of pubic symphysis pain, so that's pain in the pubic bone at the front. It consists of sacroiliac joint pain, so pain across your lower back, just below the lower back. And then so that's your pelvic girdle pain, and then the other ones that we tend to see are sciatic pain and lower back pain. A lot of people are going to have these sort of problems during pregnancy. It's really, really common. And the main things that we'll do for treatment, so belts, compression belts, can be really beneficial. And I've found these work best probably for the pelvic girdle pain and the sacroiliac joint pain. So you can get some sacroiliac joint belts that sit quite low and they provide quite a lot of compression through here. They're really good for those. And then massage may help. Just make sure, again, that your massage therapist or physio that's doing the massage is trained in pregnancy massage. Stretches, so the glute stretch I showed you before, that's a good one for your sciatic pain and your lower back pain. And the other thing to remember is strength. So keeping your strength up during pregnancy can help prevent some of these painful conditions as well. So moving on to the muscles. So obviously pregnancy is a large demand on the body. The body changes massively over that 9 months of pregnancy, and there's certain muscle groups that are affected more than others. So I'm going to start with the abdominals. So when you're pregnant, you've got your rectus abdominis muscles, so they're the ones that run straight down the front here. As you're pregnant and your belly is growing, these muscles need to stretch that way. There's only so far they can stretch in that direction. They'll get to a certain point and then they'll start to separate. That separation is what we call a rectus diastasis. And it happens, the reports that are out there vary in what they say, but it's anywhere between 70 to 100% of women. Realistically, I think it probably happens to some degree to every pregnant woman, unless you've given birth very, very, very early. It's increased in women that have twins, women that have a large increase in weight during pregnancy, and the other ones are just, you'll often notice with pregnant women, everyone sort of carries differently, and some will tend to carry more out in front, some will disperse the belly a bit more laterally, but yes, if your belly tends to push more out in front, you can be a bit more prone to that separation as well. So there's a degree of separation in pretty much everyone, but when does it become a concern, and when does physio get involved? It's usually if the separation is greater than 2 finger widths. Okay, so the separation is where these 2 longitudinal muscles have pulled apart, so they've separated, and then we measure that distance there. Okay, so if it's just a 1 finger separation, it's not a concern at all. You know, a lot of the time that will just stay as it is. It might come back a little bit closer, but that's nothing to worry about. When it gets to 2 fingers separation there or more, we will start wanting to do things to try to bring those muscles back together. So the different things we will use, so compression is often one of the first things we do. There's different things you can use for compression. In the hospital, if before you're discharged home, the midwives notice that you tend to have quite a larger separation there and they're concerned about that, they may use some tubular bandage. Okay, so that stretchy round bandage, they might pop a bit of that on initially. That's good to use in the early stages because it's not too firm, but it'll just give you some light compression. Then moving on from that, there is specific pregnancy compression. So one of the brands is SRC shapewear, and it is specific for pregnancy, post-pregnancy. They have a C-section design as well. It is very expensive though. So that's one option to look at. The other option is to just look at your general shapewear. So just your shapewear underwear that you can get from Target, Big W, Bras and Things, any sort of underwear shop. Now with these, there's a huge range, but predominantly what you're looking for is something that covers very low to up high, okay? So with some of my women, when I've assessed them, I've found that their separation's only been at the belly button and just above. So they've been okay with ones that just sort of come up to the belly button. But if the separation's coming up a bit higher, you'll need the ones that come all the way up. So it can help to actually get that assessed properly to know what you're which will benefit you the most. So it's pretty, a lot of people can assess the rectus diastasis themselves, but it might not be that accurate. So you're probably better off getting physio or midwife or doctor or someone to assess it for you. From what I've noticed, a lot of these aren't getting checked at the 6-week follow-up. Like, it probably should be a routine check at 6-week follow-up, but with your doctor or midwife, but I tend to get women that come in and when I ask them if it's been checked, they'll say no. But basically what we look for when we check it is we come down to where the belly button is and digging the fingers into here, and I'm just getting them to come up into a curl up, and as I curl up I can feel the muscle on one side and then I can feel on the other side. So, and I can still feel my separation is at 2 fingers. So mine hasn't completely come back together. Then from there I will travel down and I'll see how far down that separation comes, and I'll check how far up that separation comes. So mine's not travelling very far up or down, it's just really at the midline. And that's how we check them, and then we can work out from there whether it's something that needs to be worked on or whether it's just going to, whether it's under that 2-finger mark, and it doesn't matter. Majority of them will heal on their own, so they just will, as your tummy goes down and you start to regain that muscle tone, they will just come back. It may never come all the way back together. Like, mine will probably never come completely back. That's probably maybe as good as it will get, maybe down to 1.5 fingers. But that's okay. You can still build your strength even with that little bit of separation there. If it's greater than those 2 fingers, yeah, we'll be using things like compression, but there's also specific exercises that we will do to help draw in that rectus diastasis and build your strength up. And probably a couple of things to be aware of too. There are some things that can make it worse during pregnancy. So just being careful during pregnancy. So probably one of the main things I've seen women doing is when you're getting in and out of bed. So you're not supposed to be lying on your back when you're pregnant, and if you're getting in and out of bed like this, you tend to use your abdominal muscles too much, and that you'll get that separation and that pulling apart. So make sure it's more like when your belly starts to pop, but make sure you're doing a side roll up, in and out of bed, and a side roll coming down. Okay, and that can help prevent it. The other thing, yeah, so if you have been doing abdominal exercises during your pregnancy, just being aware when that belly starts to pop out, that you're not doing heavy abdominal exercises that may be worsening that and pulling those abdominal muscles apart. If you are noticing that you are getting a popping with your pregnant belly, so where the pregnant belly curves around, sometimes women will see when they lean back or when they sit up like that, they'll see this little pop out the top of the belly. So it'll come around smooth and then a little bit will pop out here. Sometimes we describe it as the dinosaur head. If you're seeing you're already getting that little bit of popping, that means you've already got some separation there, but you can actually wear some tubular bandage during pregnancy as well, and that will just hold that in a little bit more, and it will just pull those muscles in a little bit during your pregnancy as well. So if you're concerned that you already have that separation, you don't want it to get any worse, be careful getting in and out of bed and pop some tubular bandage on around that belly to give you that little bit of extra support. So in terms of the exercises which are safe to do for your abdominals during exercise, so usually we tend to stop abdominal work at about the 16-week mark with pregnancy, 16, 18-week mark. And that's when we're starting to get that belly popping out and those muscles are starting to go on to stretch already, so we ease off the abdominal work there. In the past, we've always kept going with some TA work, so some deep tummy muscle work and your pelvic floor work. There's starting to be some evidence come out now that if you continue to do that TA work, that you can get that actual drawing in and pulling in of the transversus abdominis can cause that pulling apart as well of the abdominals. So there was a study, I think it was a couple of years ago now, but they looked at what happens to the diastasis during, so people with a rectus diastasis, what happens under ultrasound during your transversus abdominis activation and during your rectus abdominis activation. And what they've found with a small curl up, so as you're curling up, you're actually drawing those muscles in. Whereas when you're drawing down here, you're actually drawing them apart slightly. So during pregnancy, I would try not to focus on a lot of TA work because we really don't know yet how much of an effect that's having on your rectus diastasis. So think more, concentrate on your pelvic floor and glute exercises, so you're still getting a lot of pelvic stability, but try not to overdo it with your transversus abdominis. Okay, so that's your rectus diastasis and your abdominal muscles. So I'll come back to them with post-pregnancy exercises, as I'll come back to what you can be doing for rectus diastasis post-pregnancy. So the other muscle group that's obviously majorly affected are your pelvic floor muscles. So pelvic floor muscles work like a sling, so running from your pubic bone at the front around through to your tailbone at the back. Now, the pelvic floor muscles are affected whether you have a vaginal birth or a C-section, okay? Just the sheer weight of carrying a baby puts extra load on your pelvic floor muscles, okay? So even if you've had a C-section, I still encourage you to do your pelvic floor exercises because you have had that increased load on the pelvic floor for that time. So your pelvic floor is made up of superficial layer and a deep layer as well. So the deep layer is your levator ani, so that's your pubococcygeus, your iliococcygeus, coccygeus, and your puborectalis. And your superficial layer, you've got your bulbospongiosus and your transverse peroneal and ischiocavernosus. So it's quite complex, the pelvic floor. It's often damaged with vaginal deliveries, in that the most common thing that we see are tears. So from reports, they're saying sort of around 70% of women will tear, which is quite a lot, but those tears are graded. So they're graded from 1 to 4. The grade 1 tears are being just a superficial skin tear. So these may or may not require stitching. A lot of them won't require stitching because they will just heal. Your grade 2 tears are your skin and muscular tear, and these will require stitching. Your grade 3 and 4 tears are where the tear's going from your vagina through to the anus. So the grade 3 tear just hits the anal sphincter, whereas a grade 4 tear will go through the anal sphincter to the anus. Generally with a grade 4 tear, you'll be taken into the operating theatre and that will be repaired properly because there's a lot of damage there. There's less than 1% that will get that grade 3 to 4 tear though. So we usually see grade 1 to 2 tears. Episiotomies, so an episiotomy is where you're actually cut, and that happens, they think, around sort of 10 to 15%. They really try to avoid episiotomies. They're not, I would say that number's probably decreasing over time. They try not to use them anymore unless they really, really have to. So, with all vaginal births, there's a fair bit of load. There can be a lot of trauma to the pelvic floor. So it's really important that we do rehab your pelvic floor properly. It really should be treated like any other muscle injury. So if you've had a hamstring tear, if you've had a muscle rupture that needed to be repaired, you're generally looking at a 10 to 12 week rehab for those patients anyway. It's the same thing with your pelvic floor. You really want to rehab those muscles, look after them for that 10 to 12 week period. Really common to find, it might be 6 to 12 months before you really get that strength back in your pelvic floor though, until what it was before. The other thing that can happen is Sometimes we'll see a avulsion injury, so one of the muscles, so your puborectalis, an avulsion injury is where that pulls off the pubic bone at the front, and it'll pull off on one side because the puborectalis is like a sling muscle and it can pull on one side. These will really only be picked up generally by physiotherapists or obstetricians that are doing an internal examination, because it's quite specific to pick these up. They're not, ultrasounds aren't done. MRIs aren't done for this sort of thing generally. Unfortunately, it's not often looked into that intensely, but yeah, it can be picked up by a women's health physio and obstetrician. So generally after birth, you'll probably find it's quite hard to feel the pelvic floor muscles at first if you've had a vaginal birth. And that's pretty normal. To have some level of incontinence directly post-birth is pretty normal as well. But these things should start to improve. So you should start to get that feeling back in your pelvic floor muscles, get those muscles activating again. The incontinence episodes should decrease. If you find that they're not, you're just feeling like you can't get those muscles switching on, you're having troubles with leakage, even if it's just small leakage with sneeze and cough, it is worth getting that checked out. So women's health physios, so there's Megan Kelly in Coffs Harbour, I'm down in Maxville, and we do a thorough assessment and check all those muscles to your pelvic floor, see where your strength level is at, and then make sure you're actually doing the pelvic floor muscles correctly to be able to improve that. It is a good idea to start doing pelvic floor exercises now, so you get used to what they feel like, you get into the habit of doing them, and it makes it easier to continue doing them post-birth as well. I think that's probably all on the pelvic floor. The other muscles that tend to be affected during pregnancy, I don't know why, but your glutes. A lot of women find they just tend to lose their glutes during pregnancy. So the good thing is though, glute exercises are majority of glute exercises you continue doing during your pregnancy and post-pregnancy. A lot of the Pilates exercises that we do for glutes are really good ones and are safe to do during pregnancy. So if you think about sort of the side leg work that you do, that some of you may have done in Pilates, so things like your clams, your normal clams, your reverse clams, you can be doing these with bands to create extra resistance. Your leg lifts, your leg circles, all those sorts of things are good glute ones, and your side lie exercises are pregnancy safe exercises, so they're good, and also your 4-point kneel. So another good position for pregnancy exercise is your 4-point kneel. So here you can do, again, your leg circles, leg lifts, donkey kicks, and you can increase resistance on these by adding in a band. So they're all good glute exercises to do. Post-pregnancy, so after you've had Barb and you're thinking about returning to exercise, walking's probably the first thing to start with. It's gentle, it's low impact, it's time effective, you can take Bub with you, get a good pram if you're going to be doing lots of walking, and just start little by little. So initially you might even take a friend with you and get them to push the pram so you don't even have that load of the pram, but walking's probably the best place to start. Start with those low impact exercises. Again, when you return to Pilates and yoga post-pregnancy, when you're starting out post-pregnancy, just make sure your teacher is trained again in pregnancy, just so you're not overdoing it or doing incorrect exercises. Before you return to your high impact exercise, so things like running, high impact aerobics, touch footy, netball, those sorts of things, just really important to make sure that your pelvic floor strength is back, okay? So if you're planning on returning back to high impact sports, I would suggest getting a pelvic floor assessment before you do that, because you might feel, you might be traveling along fine and be having no issues, and then you return to a high impact sport like running and jumping, and that's when you might realize you're starting to get some episodes of leakage and your pelvic floor just isn't strong enough to cope with the demands of high impact yet. And the other one to be careful of is when you're returning to abdominal exercises post-pregnancy. So if you still have some degree of rectus abdominis separation, so if there's still some separation here and you're returning to high level abdominal exercises too early, there's a chance you can increase that. So like I said before, the crunches, gentle crunches, are actually okay post-pregnancy because you're getting that drawing in. And some women find even the assisted crunch, so where you're actually using your hands to help draw the muscles in and you're doing your curl up and lower down, you're doing your pelvic floor activation at the same time. So lift through your pelvic floor, curl up with the abdominals and then lower down. So these ones are good. They're okay. But if you're going on to, your double leg work with the legs extended and you're putting a lot of strain on this area, that's when we can start to see the worsening of that diastasis. So being really careful as you progress your abdominal exercises post-pregnancy, that you're just making sure that you're not worsening that separation by doing exercises that are too heavy on the abdominals. Okay, so I think they were probably the main points I wanted to run over today. So just covering, highlighting those. So exercise, hugely beneficial. So just safely exercising and continuing that throughout your whole pregnancy if you can. During pregnancy, if you're having problems with lower back pain, pubic symphysis pain, those sorts of things, consult a physio or massage therapist that does pregnancy massage. They might be able to help you along, but keep in mind the belts do help, and keep in mind that your strength and stretching will help as well. So make sure, again, you keep up some form of exercise that's working on that flexibility, but also your strength is very important. Post-pregnancy, just being aware of your rectus diastasis and your pelvic floor, okay? So just really monitoring those as you're moving on and returning back to activities, that you are getting the increasing your strength there carefully and the right way. So I hope I've covered enough for you guys today to go over. So the few little exercises there that you can use and hopefully will help. Any other questions, feel free to email me. I'll give Suzanne my email. She can give that out to you guys on the day. And I will try to do, we do have some little video, sort of Pilates videos up on our website, and I will try to add a pre and postnatal one up onto there as well. So that might be something you can look at too if you need some extra things to go through. All right, enjoy your day. Thanks for the time, your time for listening to me. Bye.